On this edition of Veterans Health Watch, we'll learn about the VA's voluntary service program and ways that you can contribute to projects that enhance the lives of Maryland's veterans.
We'll also learn about three-dimensional mammography that will allow doctors to examine breast tissue one layer at a time, rendering more accurate readings.
Welcome to Veterans Health Watch, a program sponsored by the VA Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin.
And I'm Andrea McCoy. Kenya, as you know, the VA Voluntary Service Program is critical in accomplishing the VA mission to serve and honor America's veterans. And joining us today is Susan Kern, Program Manager for the VA Maryland Healthcare System's Voluntary Service Program. Thanks for joining us, Susan.
Well, thanks for having me. I'm glad to be here.
Well, Susan, again, thanks for being here again. We have you on annually. So could you tell us why why the Voluntary Service Program is so critical to the role of serving Maryland's veterans?
Well, with any volunteer program, volunteers should be and are in the VA supplemental staff. So they're here to do above and beyond what our very competent staff already does for the veteran patients. So you won't find volunteers doing the hands-on types of duties that our paid staff members do, but it's just all the extra things that make a veteran's stay a little bit nicer, a little bit better, and the fact that they know that there are people from the community that really care about them and come in and do it out of the goodness of their heart, not for a paycheck.
Susan, as you know, with many voluntary programs, there are requirements for becoming a VA volunteer. Can you describe some of these requirements?
Sure, I'll try to walk you through the process as best I can. First and foremost, we have an application process. So people need to fill out an application. After their application is completed and sent to one of our voluntary service offices throughout the healthcare system, then they're matched up with a voluntary service specialist. The voluntary service specialist's job is to bring the prospective volunteer in, talk to them, find out if they're going to be a good match for us. You know, when you're volunteering, just because you think you want to volunteer someplace, it isn't necessarily the right place for you, or you might not be the right place for the right person for the place that you're going to. So it's sort of a little give and take there to find out when you go on an interview for a volunteer position, you should be asking as many questions about the place as they're asking about you to find out. So that happens, and once the voluntary service specialist deems that this is going to be a good match, you're going to be a good fit in our organization, then we have some background investigation work that has to be done. We take our patients, their safety and security very, very seriously. And it is a VA requirement within our healthcare system that all volunteers are background checked. So we literally fingerprint all prospective volunteers, and we have to wait for the fingerprints to come back. And as long as an individual is adjudicated, then they can come on board. The next step would be to come to our general orientation class. So we want people to get an idea what our VA is about, and after that process, then you're assigned to a spot to go. You get more training, and we keep on training you. So,
thank you.
And believe it or not, summer is right around the corner. So are there any opportunities available for young people to volunteer with the VA Maryland Healthcare System?
There are. We have a youth volunteer program. The majority of youth that come in to volunteer with us do come in the summer when they have some extra time. But you have to be 14 minimum. And then our youth, once you turn 18, you go off of the youth roles and you become an adult volunteer. We have lots of fun things that we do. One of the really nice things about our youth program is it really allows a young person the opportunity to see what it's like to be in a healthcare environment. When you sign up to be a volunteer in our youth program, you're expected to commit to a minimum of 75 hours. You have to follow the rules and regulations, are really very good steps in helping a young person be ready to go out into the workforce.
Susan, tell me, are there any volunteer alternatives available for those who would like to give back but cannot commit to the required hours?
Sure. We have the majority of our volunteers that come in are under what's called the regularly scheduled volunteer program. And they're people that commit, they might commit once a week, twice a week, maybe it's only once a month. I say only, I don't mean it that's a bad thing, but there's a commitment that you would see someone on a regular type of a basis. But we also have what's called occasional volunteers, and occasional volunteers are individuals that come in kind of two different ways. The first way is through our group volunteer program. And so really you're an individual, you belong to a group, and your group wants to come in and do something within the VA. So your group comes in and your hours are counted towards the group, thus you're an in the occasional volunteer status. We also have individuals that come for special occasions. They have a nice experience, but that's their experience. They're not doing something on a regular basis.
Thank you.
And so for those people who are listening or watching and maybe they're a little intimidated by working in a healthcare setting, you kind of hinted at this. How should they go about determining if working at the VA is the right fit for them?
Well, first off, my suggestion would be to come in and talk to one of our specialists, because we can certainly tell you what kind of volunteer opportunities we have, and we have a lot. They kind of fall in two categories: either working with and around the patients, but we also have opportunities for people that want to work behind the scenes, maybe in an office type of setting. There's plenty of people that might think that they'd like to come into a hospital type of setting, but again, they get there and they think, oh my gosh, I'm around sick people. So an office type of a situation would be really good for them. So, it doesn't hurt to get information. And remember when I said that when you come in to decide about volunteering, it's just as much of your responsibility to find out if this is a place I want to be as it is for our responsibility to find out if you're the right fit match within our organization. So, I suggest to anybody, if you're going anywhere to volunteer, you want to find out about what the mission is. Is the mission something you believe in? Because if you don't believe in somebody's mission, you really don't belong volunteering. And that's not just in our organization, that's anywhere.
So tell me, as the needs of our veteran population changes, so are the programs and services offered throughout the VA Maryland healthcare system. Are there any programs that need any specific programs that need volunteer support?
Well, we always need volunteers for a lot of different things. But I would say that one of the things that I've seen over the past few years is a real push and need in specific types of programs. For example, volunteers that support the homeless veteran mission, or volunteers that support the women's veterans mission, or volunteers that support our OEF, Operation Enduring Freedom, Operation Iraqi Freedom, that program specifically. So those are three that I mentioned. We have volunteers that work in our hospice program. So again, I go back to like programmatic versus people coming in and doing things that are more of a general, more for the general patient.
Well, Susan, thank you so much for sharing information with us about the volunteer program. We're going to take a short break, but when we return, Susan will rejoin us to talk more about gifts and donations for the VA Maryland healthcare system. So please stay tuned.
The VA Maryland healthcare system is the overall healthcare system for veterans in the state of Maryland.
We have 3 inpatient locations as well as 6 community-based outpatient clinics.
The treatment that I've received from the Maryland VA healthcare system, it's been top-notch, definitely cutting edge.
I think what makes the VA innovative is constantly exploring new ways to become more efficient and more effective. We were the first hospital in the world to make the transition from film-based radiology to filmless radiology.
We measure everything we do. We are always keeping track of our ability to deliver the standard of medical care to all our patients. We have the most committed, diverse, and caring group of professionals.
You know, a lot of us have served in the services. These guys and these ladies, I mean, they're everything to us. And there's nothing I would not do for them.
I did not know where to turn, and I called the hotline, and they really helped me. I was in a very dark place.
My family called for me. I did not realize that I needed help, but I'm glad they called. I'm doing so much better now. I'm working again.
The hotline staff was very supportive, and it connected me to a program at my local VA.
The suicide prevention team helps me when I need refills of my medication or need an appointment quickly with my doctor.
I thought that I would feel uncomfortable talking about my PTSD with a therapist, but it has helped me live a better life.
The suicide prevention team sends cards to me each month to check on me. That makes me feel special.
I was depressed and had relapsed, and the VA provided me with good mental health and drug treatment. I have now been clean and sober for 18 months.
It does take courage to ask for help, but once you do, you will get the help and support you need to feel better. It worked for me.
Welcome back to Veterans Health Watch. Rejoining us is Susan Kern, the Voluntary Service Program Manager for the VA Maryland Healthcare System, here to talk about the gift and donation program for Maryland's veterans. Thank you for rejoining us. So Susan, could you describe the donation program for the VA Maryland Healthcare System?
Sure. We have a donation program that runs throughout our healthcare system, and it's in 2 parts. There are individuals, or there's the opportunity, I should say, for individuals to make monetary donations. So that's one piece. The second piece is for people to make in-kind donations. And in-kind donations might be in 2 segments. One being actual items, goods, those kinds of things. The other might be in-kind donations that are related to activities. So there's several different opportunities to give within our healthcare system.
So what type of VA Maryland healthcare system programs or activities are supported by monetary donations?
Well, plenty. I think we have, over 20 some general post-fund accounts, and that's what we call them. And they earmark a particular program or a facility. For example, we have now 6 CBOCs, which are community-based outpatient centers, and each one of them has their own GPF account. So people that want to make donations specifically to one of our outpatient centers, for example, our Loch Raven community-based outpatient center, they can do that, and that money will be put into that account and can be used only for the needs at the Loch Raven outpatient center. But we also have program-specific kinds of funding, and they would be, for example, throughout the healthcare system, we have a women's health GPF fund. We also have a homeless veteran program. We have site-specific site-specific GPF, which would be, let's say, for one of our particular sites, we might have a social work account where patients that are within those that particular facility, if they need some transportation, those social work funds are usually like indigent patient needs. So hopefully I answered your question. That's a little bit of the kind of differences between the GPFs.
And how can a person who's interested in giving to one of these accounts or one of these funds, how can they go about donating?
Well, the best thing is to call one of our offices. And I say that because people work really hard for their money, and people want to do really good things, but you want to make sure that your funds are going to where they're really needed. You don't want to put funds into an area where we already have a good amount of money. So it's always best to talk to somebody from the Voluntary Service Division so that we can tell you, well, here's a real need, and then we can guide you that way. So that would be my suggestion, really.
And I know for those folks who like to cruise the internet or do everything over the internet, the VA now offers an opportunity for those people to donate through eDonate. So could you explain that program to us?
And that is just so exciting for us because this is a brand new program. It's actually a national program, was marketed through our national office, VA, but and was sent down to several of our VISNs, which is the Veteran Integrated Service Network, and we're in VISN 5. And we were like a pilot, one of the pilot places. And it's just so exciting because up until this point, if you wanted to make a donation online, we didn't have the mechanism to do that. So you had to pretty much send a check in and to get your donation is. But you could go right online now onto our web page and follow the instructions right there, and you can make your donation right online. There are specific GPF funds that you can earmark your money for, and it's just really great. It's wonderful for us that has happened.
It is.
So tell me, what types of patient projects are supported by monetary donations? And how do our donors know that their money is going towards the specific program that they designate?
Well, first off, legally we have to do that, okay? So we have to put the money where a person specifies it to go. Now we have an all-purpose account, which is the wonderful account for us, because with all-purpose money, you can use it for pretty much everything. But when stuff is earmarked and it has to be used specifically, so when someone would make a donation, they would put on the either their letter that they send in or on the check itself, I want this money to be earmarked for the recreation account, and then we would have to earmark it. There's lots of different, again, GPFs that people can put their money towards. Contacting our office is the best thing to get an idea of where needs are, but most of our things are patient related.
Susan, what if a veteran or community member wants to leave a portion or all of his or her estate to the VA Maryland healthcare system as part of his or her last will and testament?
Well, we like that, and we encourage that as well. We've had some really nice bequests in the past couple years with some funds from some of our veteran patients that wanted the money to go to the good of their fellow veteran. With some of those funds, for example, we have a really nice 4-lane bowling alley at our Perry Point facility. It's in our gymnasium area, and that's thanks to Mr. Lloyd, and obviously it's called Lloyd Lanes. And we also have a wonderful coffee bar that's in our outpatient center at our Perry Point facility as well, and that's thanks to the generosity of a Mr. Quivy, and it's called Quivy's Coffee. So we have we use the funds for a good purpose. So.
And how can a person go about making a monetary donation in the memory of a loved one?
We also encourage that as well. And what, again, they can earmark what they want the funds for. We take the memorial donations, then we contact the family, next to kin of the individual who it's in memory for, and see if they have a specific area that they'd like the money to go to, or if they'd like for it to go to the all-purpose fund.
If our viewers have any questions about any of the patient projects or types of donations that you have presented, who do they call?
Well, call the voluntary service office, and I'm pretty sure you'll be putting that on the screen, the phone number. So call our office. We will be able to answer your questions. You can also go online, and that's at www.maryland.va.gov.
Well, Susan, thanks again for joining us, and we really appreciate you coming on every year and telling us more about the voluntary service program. We hope your phones will be ringing off the hook soon.
Well, we love volunteers, so check us out.
We're going to take a short break right now, but when we return, we'll be at the Baltimore VA Medical Center's Imaging Department, where we'll learn more about the new 3-dimensional mammography program for women veterans. So please stay tuned.
Those veterans who don't enroll in care, many times if you ask them if they're a vet, they'll say no, but I did serve in the military.
Anyone that made that commitment to put your life on the line for others is a veteran.
The system is very accessible. For instance, enrollment. We have 3 ways to enroll.
You can enroll online, you can physically go into the VA and enroll, or you can telephone to enroll.
Doesn't cost anything to enroll. All it takes is a few minutes of your time and a copy of your DD-214. That's all you need.
I'm a veteran myself, and I tell the family, when you entrust the care of your loved one to me, you can go home safe and very at ease.
Best thing that you can do is just come in and apply.
Without a doubt, any veteran definitely owes it to themselves to enroll. You know, your health and well-being is priceless.
Welcome back to Veterans Health Watch. I'm Dr. Catherine Staropoli, and we're here at the Baltimore VA Medical Center Imaging Department with radiologist Rocky Goyle. Welcome, Dr. Goyle.
Thank you.
I'm sure much of our viewing audience has heard, either through TV or through local newspapers, about the new 3-dimensional mammogram imaging that we have available here at Baltimore VA. And this is the first VA in the country to have this imaging available. Can you tell us a little bit about it?
Yes, we're very excited to offer this to our veteran patients. 3D mammography, also called breast tomosynthesis, is the latest technology available in breast cancer screening. It allows the radiologist to look through the breast tissue one thin layer at a time so that we can offer more accurate readings and pick up breast cancer at its smallest and earlier stages when it's more treatable.
Can you tell us a little bit about the difference between a traditional mammography and the 3-dimensional mammography?
Yeah, the exam itself is very similar. Identical to a regular mammogram, the patient will be positioned in the machine by the technologist and have her breast compressed by paddles. The main difference is that the camera, in addition to being stationary, will swing in an arc over the breast and take pictures at different angles, and then that data can be used to construct the 3D model.
Do you think that this new 3-dimensional technology will be used to replace traditional mammograms, or will be used in conjunction with traditional mammograms?
Right now, tomosynthesis is performed in addition to the regular mammogram because that's the way it's been shown to be the most effective and picked up the most cancers. As the technology is used more and more research is performed, that's something that could change in the future, but right now both are performed.
So for patients, what are the overall benefits of getting a 3D mammogram versus a traditional mammogram?
3D mammograms eliminate the breast tissue overlap. That's a major source for the need of repeat imaging. The breast is made up of different types of tissue, including fat and dense glandular tissue. And when these 3D structures overlap in a 2D image, it can be a bit like looking through a smoky haze, where either small cancers can be hidden or there can be the false appearance that there's something there when there's not. With 3D mammograms, because we're able to look through the breast tissue 1 millimeter at a time, it eliminates a lot of that overlap so that we can pick up small cancers that we may have otherwise not seen, as well as give more confident negative readings and reduce the need for patients to come back for additional images that weren't really needed and reduce their stress.
So that's a great benefit for patients. It sounds like it's a more accurate type of technology than our traditional mammogram.
Yeah, it's definitely been shown to be more accurate and sensitive.
That's terrific. Well, can you tell us how can our veterans access this kind of technology here in Baltimore?
Any veteran patient who is already enrolled in the VA Maryland healthcare system who then has a regular mammogram ordered by their doctor will automatically receive the tomosynthesis.
Great. Well, I know that men can get breast cancer too, and does this technology benefit men as well?
You're right, men definitely can get breast cancer, and if they are having a concerning breast symptom, their doctor usually orders a mammogram for them, and we perform the tomosynthesis in addition to the regular mammogram on male patients as well as female, so that they can receive the additional benefit of the increased sensitivity.
Okay. How about patients that are in the community-based outpatient clinics in Maryland? How can they access getting this type of mammogram?
Right now, tomosynthesis is only performed here at the Baltimore VA because of certain technical requirements, but any patient who is already in the VA Maryland healthcare system is welcome to come here for the exam.
So Dr. Gohl, there's a lot of information out there about when people should get mammograms. How do veterans know when they should come and get a mammogram?
So there are very different guidelines indicating when patients should start screening for breast cancer, and I would advise that a female talk to their primary care physician and come up with a plan that's right for them. I do want to emphasize that breast cancer screening with mammography is one of the most valuable tools we have in fighting breast cancer and reducing the rate of death in women from breast cancer in this country.
Dr. Gohl, how have the patients received this kind of new technology? What's been the experience that you've found with patients receiving these kind of mammograms?
The patients have reacted favorably. I think in general that they've appreciated receiving the latest advanced technique that has a better chance of detecting a real problem.
If one of our veterans is interested in more information about the tomosynthesis mammograms, where can they get that information?
They can call our mammography department and we'll be happy to answer whatever questions they have.
Dr. Gohl, thanks so much for sharing all this information about this great new technology that we have here in Baltimore. And now back to the studio.
Thank you, Dr. Starpoli. Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or visit us on the web, or you can even join us on Facebook or Twitter.
If you are a veteran or know a veteran who is not enrolled for VA health care, please call our enrollment center at 1-800-463-6295, extension 7324, or visit your local VA medical center or visit us online. We look forward to hearing from you soon. Thank you for joining us.
See you next time.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.